Dr. Cohen, can you educate me about vaginas? I'm with Dr. Cohen right now. We're in the operating room. We're doing a joint case and we're in the middle of it. People don't talk about it because it's a shy area, but labiaplasty makes such a massive, massive difference. This is impressive, so I'll give you just a little peek safely, and then I'll put a link that you guys can follow. So I'm blocking it so it's safer, but this is labiaplasty, and it's longer, and I'm gonna put a link to it.
Do a lot of what's called labiaplasty, which is generally a reduction of the labia minora, or the inner labial lips. The reason for that, usually two. One is that some patients just find it sticks out too far, or they just don't like the way it looks. Another reason is some patients, it causes discomfort, either during sexual intercourse, or it can rub on tight jeans, or if they're riding a bicycle, it can cause discomfort. And a lot of times, is a combination of those two problems. So there's two basic ways to kind of fix this problem. I'll draw a quick picture to show you.
Draw some vaginas.
Yeah, exactly. All right, so if this is the vaginal opening here, and you're pulling the labia part.
The introitus.
The introitus, exactly. This is the clitoral area up here. And if you're pulling the labia, the inner labia part, it usually looks something like this. So the two different options are to do a trim method, which I don't like, and the wedge resection, which I do like. So a trim method, basically, you just trim off all of this tissue like that, and then you have a suture line running all the way down the labia, which I don't think looks very good. A lot of times it can have a little bit of a little bump. I see patients where they come in, they've had it before and they have a little irregularity here and here, or it can be kind of like a little scalloped looking, like a little rough on the edge, which doesn't look nice. What I do is a wedge resection where I'm basically taking out a wedge of tissue like this, and then this point here and this point here will come together like that. So what'll happen at the end is rather than having this long stitch line running all the way down, you have basically a stitch line that runs just like that. If you do the wedge resection like I was drawing there, the suture line is very hard to see. You have the natural edge of the labia, which looks normal, so you don't have that stitch line. And the other advantage is that when you're putting the wedge together, it's pulling the tissue this way. So what happens is it pulls some of the tissue, the excess around the clitoris down, and pulls some of the tissue that can bunch around here up, and it actually makes the opening to the vagina a little bit smaller. So some patients will report maybe better sensation during sexual intercourse, or just feeling more, everything's kind of tidier down there, and they just feel more comfortable. It's probably one of the most satisfying surgeries that I do in terms of patient happiness.
Yeah, so I mean, it's super, super impressive, and I think for like just confidence and things like that, it's got to be amazing. I don't have personal like vagina experience for myself, but like what I'm talking about vagina. 1 second, but still, I mean, it's got to be the photos were very impressive, and I've seen them before, but like you showing me and kind of walking me through what happened it's really impressive.
Like I said, it's a feel-good surgery. Patients are usually very, very happy, and once it's done, you're pretty much good to go. So there's not a lot of maintenance or anything else involved. And it's a fairly small area, so people usually recover quite nicely.